Chain Drug Review, and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello everyone, I'm Jeffrey Wolt, Editor-in-Chief of Retail Media IQ. Welcome to a special edition of our video forum where we will take a deeper look at Chain Drug Review's e-commerce healthcare provider of the year, Amazon Health. Amazon was honored by the publication for its work in bringing its expertise in technology and logistics to healthcare. Executives there are in the process of developing what they refer to as Pharmacy 3.0. Today we have two of them with us to talk about Amazon's work. Dr. Vin Gupta, Chief Medical Officer at Amazon Pharmacy, and Vice President of Pharmacy, John Love. Vin talks about the unique perspective that his work as a physician brings to Amazon Pharmacy.
My perspectives on what I think we do so well is informed by what I do at the bedside. And so I have that unique perspective of still being an intensivist within the four walls of a health system, part of my time, and the other part of my time here at Amazon. And what I see is the downstream impact of people, for whatever reason, not being able to effectively engage with basic primary care. And there's a cascading effect. Often we see it with uncontrolled high blood pressure. That is the leading risk factor for death across the world, Jeff. You and I have had this conversation. But take that as an example. I think about the patient that I just cared for 2 nights ago with a hemorrhagic stroke, who will never be the same again and is on a ventilator. And unfortunately, that individual didn't really know that they had stage 2 hypertension until it was too late, and there was already downstream consequences to their heart and then ultimately to their brain. Imagine the opportunity we would have if at scale we could tell people that they have something wrong with them, with their bodies, that there's a silent killer like hypertension lurking. And through pharmacy, also through, by the way, One Medical perhaps being that vehicle to give them that insight, but marrying that, Jeff, with the pharmacy experience of just an easy, navigable, easily discoverable experience where you know what you're going to pay for, you know when you're going to get your medication, whether for an acute need or a chronic need.
Vin discusses the shortcomings of healthcare and pharmacy as currently constituted.
We tried that for decades, especially pre-pandemic, and here we are. It didn't work. And we were caught flat-footed throughout the pandemic. All these trend lines I'm talking to you about didn't just occur over the last few years. They've been existing in our population for the last century, if not more. So what's been passed is not prologue and should not be a standard of business moving forward. Patients deserve something better. If that worked, that model, the retail model, if that actually worked, we would see signs of that. We wouldn't be having you probably wouldn't be giving us the award, and we wouldn't be having this conversation. We're having this conversation because that old anachronistic model did not work. And frankly, I think the pandemic magnified it, that this concept of early diagnosis, early treatment, especially for an acute condition like COVID-19, turns out we are not good at enabling a rapid triage with treatment experience at scale, maybe in pockets. So that's where I think virtual makes a lot of sense. And really behaviors are changing to meet that moment. And we've been innovating pre-pandemic on this set of experiences in our core assets in healthcare, Amazon Pharmacy, previously PillPack, and then One Medical. They've existed long before the pandemic. What I love about this moment, though, is the American patient has changed their preferences and how they want to consume healthcare. I've seen this. To the extent possible, if they can stay at home and get high quality care at home reliably, then they're willing to take a chance at that. Whereas pre-pandemic, I think even the willingness to take a chance at something different was far lower. So it's the convergence of innovation meeting the moment.
John Love comments on Amazon's basic approach to improving pharmacy service.
We're building products and services that help people, improve their health, and there's nothing more important than that. On the pharmacy front, fundamentally what it is it's helping people afford and get access to products that make their lives better. That's something I've worked on a long time. And so the ability to be able to get you medication reliably and quickly to your doorstep, I think is a super interesting challenge.
Love elaborates on Amazon's attempt to create a new pharmacy model that moves beyond traditional brick and mortar stores and mail service.
When I came into pharmacy after working in other spaces, I was amazed to find that the fax machines were chugging away. The amount of administration, paperwork, waste, the amount of like clinical reviews that go and they get blocked by, prior auth or access or refill too soon. There's so many complicated edge cases in pharmacy that are still quite a bit dated relative to modern technologies. Why can't you see a price of an item that you're consuming? Like that's in almost anything else we do in our lives. You get to know the price of a thing that you're looking for. But in pharmacy, you might have to go stand and wait in a line 20 minutes in a public setting to hear the price and then learn whether you can afford it or not. And so what inspires me is inventing a third type of pharmacy. We're kind of loosely, it's a 3.0 model of pharmacy. You've got retail pharmacy, which is very predictable and you can go, but all of the burden is on the patient. You work around their hours, their time and availability. You're going to drive, park, wait. The closest options where I live, I'd be standing, in a deli aisle, next to meat and cheese and, potentially talking about a private health concern. And then, we've had mail order services in the United States, so delivering products is not new, but those haven't evolved. They're very feature light. They don't have savings programs to a great extent. And the delivery time has kind of stagnated at 5 to 10 days. And obviously at Amazon, 5 to 10 days feels like a lifetime. And particularly for medication, where you might start feeling better right after taking a dose.
He says the objective is to eliminate pain points for patients and caregivers.
And so our vision is the store is in your pocket. You engage with the pharmacy 24/7, whenever it's convenient for you. We don't mind what, if your kids have a soccer game or you're working odd hours or a second job, you can pop into the pharmacy, you can see the medication, you can learn about it, understand the price, both with cash, if you have high deductible, or you might be on a gap in insurance coverage, or, an estimated price of copay with insurance. And then, medications are delivered privately, reliably to your doorstep, so you don't have to go out and you can save that time for something you enjoy. It sounds simple, but I think it's super powerful. And we see that that's improving access and adherence.
The receptiveness of other healthcare providers will play a critical role in Amazon's success. Gupta says the company is developing a model that will help improve clinical outcomes while making the lives of consumers easier.
And so our hypothesis is if we can guarantee an experience, which we know we're good at, and apply that to the pharmacy space, focusing on speed, also focusing on price transparency, making sure people are paying the lowest cost possible, that there's a magic combination there when applied to somebody's pharmacy experience that they'll like. And especially as behaviors are changing, that not only will they like it, but it's going to translate to something meaningful from a clinical outcome standpoint downstream. We're already seeing signs of it. I'll say that we are in the midst of finalizing a peer-reviewed paper that's already been accepted into one of the leading journals in the country. I look forward to sharing that with you. But it's basically proving out this hypothesis that making things easier, just more lovable, and with a clear pricing up front on a set of medications, that combination actually can improve adherence and save money. We're actually proving that out in the peer-reviewed literature. And I think the challenge here is how do you convince providers to take a look? Because often patients will follow their providers and take their advice. Providers are now back to being the leading source of health information for patients across the country. It took a dip in the throes of the pandemic, but now we're back where I think our rightful position should be as the purveyor of accurate information for our patients. And unless we can convince providers that one, this is a different experience, not the experience that maybe you trained with, and that two, this is not just another point solution or an innovative tool that people like to talk about. No, that there is a direct correlation between what we're doing and what it means for your patient and their downstream clinical outcomes. If we can't tell a story on data and return on investment and their investment of time, namely, take the time to counsel your patient about the benefits of home delivery, talk about and maybe perhaps give a shot at something that might seem a little different, like us, we're not the only ones, that are trying to innovate on a better pharmacy experience. If we can't give providers a clear data story on why this actually can help improve clinical outcomes, then we're just another point solution. So to me, this is all about evidence generation. It's all about showing that our core value proposition, while it might seem like it's focused on, we talk about terms like convenience, value, affordability, really it's about a laser focus on clinical outcomes, optimizing them.
Amazon Pharmacy is ramping up growth with plans to offer same-day prescription delivery in 20 additional markets by the end of this year. Love explains how the company's technology enables it to open one new pharmacy facility every 18 days.
We're building on the back of an Amazon invention. So coming out of COVID, Amazon overhauled a bunch of our supply chain and logistics to position products closer to customers. And what that enables is waves of delivery throughout the day. So you can get delivery in, maybe a few hours versus a couple days. And so what we've done is we've built a fully operating pharmacy as a module within these same day fulfillment centers. So we're putting medications and clinical teams closer to customers. That dramatically improves speed. And so these are smaller than our regional pharmacies that, can ship and have capabilities to cover the US. And so we've got sites running in the greater LA area, in Corona, California, in Orlando. And really what we want to do is we're looking at how do we increase the speed and access for every US life. And that's the motivating factor.